Great. Thank you. Let me get my screens in order here and I will start sharing in just a moment. Sorry, all. Thanks for your patience. Okay, are you guys able to see my screen? Okay, great. And yeah, trying to see as many of your faces as I can while I'm also presenting, but Leanne, feel free to interrupt me if anything comes up that I'm not able to spot while I'm presenting here. Okay. So like Thomas said, myself and some of my colleagues at my employer, LeSar Development Consultants, have been working with the Douglas County Highside Group, I think since like late October is when we first started having meetings. Like Thomas said, I used to live in Roseburg, have a lot of connections in the community, really happy and feel really, really privileged to be able to work with you guys in a community that's really close to my heart. A little bit of background about LeSar Development Consultants, or LDC. We are based in California, although we do work all up and down the West Coast and also nationally. We primarily do public sector consulting, so usually cities and counties, sometimes nonprofit organizations, philanthropic organizations, things like that. And our firm is focused almost exclusively on affordable housing and homelessness. So this kind of planning roadmap type of project is really our bread and butter. Thomas mentioned City of Medford that we did work with, gosh, I think back in 2018, something like that. We've also done work with numerous cities and counties in California. This is, I think, one of the first ones that we've done that focus specifically on a subpopulation, that being youth, children and youth. So yeah, I have a short presentation today, just a heads up. I know it's a lot of information. I'm going to try to move through it pretty quickly. Like Leanne said, this is being recorded. I'm going to share my contact info, so you can feel free to reach out to me with any questions. There will be some time for discussion at the end, but I wanted to fit as much as I could into this meeting and hopefully move through it pretty quickly. So I'm going to dive right in. Very short agenda for today. We're going to talk about some data. A lot of these data, many of you have probably already heard before, but we're still going to try to move through that. And so sorry if it's duplicative with anything that you've seen in the recent past. This slide talks a little bit about the federal point in time count. I think a lot of you are familiar with the point in time, or the PIT count, the homeless count. These are not perfect numbers. HUD defines how the count is done and what the definition is. Every year the count's done at the same time, every year all across the country. So there are some limitations in the data. These numbers aren't meant to be a complete catch-all of everyone who might experience homelessness throughout the course of a year, but it does measure everyone in the country who's experiencing homelessness on a very short span of time in January of every year. The balance of state continuum of care that's referenced here. A continuum of care is sort of an administrative body that handles HUD homelessness funding that's coming down. The balance of state includes Douglas County and several other predominantly rural counties. So the way that these data kind of pan out, for this number, Douglas County is lumped in with those other communities. And basically this 5-year chart that's over here shows total homelessness, as well as children under age 18 and transition aged youth age 18 to 24. You can see that there's kind of some big 1-year swings in some of the numbers, but overall, the takeaway in these 5-year trends is that the numbers have been pretty flat. This is pretty similar when you compare the balance of state with some of your neighbors in Lane County and in Jackson County. I know that these graphs are maybe a little bit difficult to read, but they're basically showing the percent change in total homelessness, child homelessness, and TAY homelessness over the course of 5 years. And so again, while you might see some headlines about really large 1-year increases or decreases, the takeaway, if you look at the data more long-term, is that these numbers have been pretty flat. So another source of information is what's called McKinneyVento Data, which captures young people who are enrolled in school and are experiencing homelessness. These numbers are defined a little bit differently. They have a slightly different definition of homelessness, and also these numbers capture everyone in the school who identifies as homeless at any point during the school year. So unlike the point in time count, that's like literally one day or a couple of days in January, this captures the school year. You can see the percentage of students has been, relatively flat the last several school years, but there are several school districts that are far outside of these norms. So this chart here shows student homelessness for 17-18 and 18-19 school years. Kind of in the middle of this chart, you can see the state of Oregon average, and then slightly to the left, the Douglas County average. And you can see that there are several school districts that have really alarmingly high rates of homelessness, places like Reedsport and Glendale at almost 5 times what the average is. And these are some of the highest rates in the country. So definitely very, very alarming student homelessness data. I was able to pull some information from UCAN, their federal grants. This gets a little inside baseball for sure, but the way that the COC functions is that they pass through the federal dollars to local service providers in Douglas and Josephine County. The primary provider is UCAN. Because these are federal dollars, these providers are required to put their information into a system called HMIS, Homeless Management Information System. And some of those data are available in a de-identified way. So you can't necessarily see, each individual person who's passing through the system, but I was able to look at some aggregate data. So these numbers show in calendar year 2020 and 2021, the total number of people served, as well as some demographic data breaking down some of the age groups of people being served who are their children or transition-aged youth. And the takeaway is that about 1/3 of people getting federally funded homelessness services at UCAN are children under the age of 18, and a lot of those are very young children under the age of 12. So in looking at the services that were provided with these federal funds through UCAN, prevention was by far the most common. And if you look at some of the data on where someone was residing immediately before presenting for homelessness services, and then where they exited to when they left the homeless services system, it was to their own home without any ongoing rental subsidy. So these data suggest that prevention is what people need, and also that it works, and that when they're able to leave the system, more than half of them do so to their own home, which is great to see. Let's see here. Oh, something else I'll say about this. So like I said, these are the federal grants. So these data do not show who UCAN is serving with other sources of funding. They might be reported through a different system. It doesn't capture what might be privately funded. So yeah, again, there are limitations in these data. The full report that is being drafted tries to address all of these gaps in data, and it's not unusual for us to have to put together kind of a patchwork of the available data. So there's limitations in all of the data that are available, but we're trying to use everything we have to try to put together a more complete picture. This slide I know is hard to read, but basically this is looking at nationally how the state of Oregon compares to other states, and also how the balance of state continuum of care compares to demographically and geographically similar areas. And the takeaway on this slide, I don't really expect you to read every single bullet point, but As you know, homelessness and statistics about homelessness are very bad up and down the West Coast. California, Oregon, Washington, Hawaii, and a couple of other states are really the epicenter of a homelessness crisis in the United States. And then even kind of drilling down to the rural counties in Oregon, you'll see some of these stats in the right-hand column, third highest number of people experiencing homelessness, fourth highest, third highest number. And these are top fives that you really don't want to be in. So these are highest numbers of people, especially some of these subpopulations like unaccompanied youth. And then within that, some of the highest rates of some of these subpopulations being unsheltered. So, again, we have the data for the region, for the county, some of the school districts, some of the service providers, and then trying to compare how rural Oregon compares to other rural areas, as well as how the state compares to other states. We also pulled some information on child and family poverty. These numbers come from census data, the American Community Survey 5-year trend data. And as you can see, Douglas County outpaces the state of Oregon in almost every demographic category for people living below the federal poverty line. That's the federal poverty line, so it's not really adjusted for the high cost of living on the West Coast. In 2022, the federal poverty line was something like $13,000 to $14,000 for an individual, and I think only like $28,000 for a family of 4, which is not really a lot nationally speaking, but especially in a really expensive market like anywhere on the West Coast, that also just doesn't go very far. And as you can see here, for children, so child homelessness, especially very young children under the age of 5, and for families with young children, rates of poverty are really alarmingly high, especially on the far right-hand side of this graph. For female-headed households with children under the age of 5, you're approaching almost 2 out of 3 households are living below the federal poverty line. We did numerous qualitative interviews as part of this process also. Some of you on this meeting have maybe been interviewed by myself or by some of my colleagues. We tried to pull out some high-level information. There are many pages of summary information from these stakeholder interviews in the report. This has an asterisk next to it because some stakeholder interviews are ongoing in a limited way, although we are trying to wrap up this process, but just wanted to make a note of that. Obviously, people cited economic reasons that people are destabilized in their housing, as well as some social reasons. Strained family relationships, including trauma in the home, family rejection are also reasons that young people might experience homelessness. Like Thomas referenced at the top of the call, there's a need for inclusive and low barrier services, especially for youth who are maybe older teens or transition aged youth, or for families who have children over a certain age and are maybe not able to stay in more traditional family shelters. Alternative housing models were also something that was brought up as being in need. There's a little more on that on the next slide. Of course, Douglas County is a very large area geographically, so pretty much everybody brought up the lack of transportation and the difficulty with connectivity across different areas of the county. Pretty much everyone cited the need for more mental and behavioral health care services. I don't think that's a surprise to anybody on this call. But something we did hear repeatedly over and over is that there's really a strong positive impression of a lot of service providers. Again, seeing kind of who people are or where people are from when they type into the chat. It's a lot of you have gotten some really positive shout outs in these stakeholder interviews that we've done. I did pull out a couple of quotes. Again, I know this is a little hard to read, so I'm just going to read it verbatim from the slide. Quote, "It's so difficult to access services that we're only touching about 10% of people who really need it. So while we have a ton of agencies providing services, those services need to be expanded." Regarding the transportation issue, quote, if you're an hour from Roseburg, you may as well be in California. That's how this person described the difficulty with transportation. There's a need for youth to have a front porch to address, quote, the emergency need of where are they going to go tonight. This we hear a lot, quote, housing is a gap. I'm sure you hear that all the time, but we can't stop screaming it. We're in a crisis of affordable housing. Rents are outrageous. And then to my earlier point, so quote, choice between foster home and a residential facility is not a great choice. It would be great if we gave them an option where they weren't being asked to either integrate into a family or to be in a residential treatment program. Several people referenced advocacy, quote, youth need someone who explains to them what their rights are and what supportive services are available to them. Quote, kids need more caring adults outside of school. And I liked this kind of solutions-oriented quote here at the end. Believe it or not, there's an easy way that this can be done, which may be easy to talk about, not as easy to implement, but we're also not recommending anyone reinvent the wheel here. There are things that work well in other communities and similar communities. There's a lot of assets to build upon in the community. So that was really one of the places that we wanted to start when we were thinking about actually turning some of these data, some of this analysis into recommendations for the community. I wanted to talk about some special populations really quickly. Again, I know there's a ton of text on this slide. We were asked to look specifically at youth in foster care or aging out of foster care, LGBTQ plus youth, and also youth who are surviving or at risk of experiencing trafficking. So there are some groups that are particularly vulnerable to experiencing homelessness as children or as youth. So nationally, approximately a third of homeless youth identify as LGBTQ plus, which is compared to less than 10% of the US population. So there's a 3 times disproportionate rate there. Family rejection is one of the leading, but not the only causes of youth homelessness. Again, I'm sure a lot of you have encountered that in your work. LGBTQ plus youth might experience more harassment, more stigmatization, more difficulty accessing services. And they're also at an increased risk of abuse or harassment in unsheltered situations on the streets as well. One study with your neighbors to the north in Washington State looked at youth aging out of foster care and found that about 25% of young people who aged out of foster care became homeless at some point within a year of aging out. There were some particular risk factors. So youth who had more than one foster care placement were 1.5 times as likely to experience homelessness. A similar risk factor with those who had justice system involvement. And those with frequent school changes were twice as likely to experience homelessness within a year of aging out of foster care. And for your reference, I think frequent school changes, quote unquote, was defined as 3 or more changes within 2 years. But then the flip side of this is that there were some protective factors. So being able to maintain school continuity and good school attendance and school performance were a protective factor against experiencing homelessness, as was being placed in foster care with a family member. Those individuals had much lower risks of experiencing homelessness after aging out. Experiencing homelessness in and of itself is traumatic. So earlier I talked about prevention wherever it's possible. You know, if you're looking at those child and family poverty data, to think about upstream solutions that can prevent an experience of homelessness whenever it's possible is great, because there's just trauma in and of itself in experiencing an episode of homelessness, and it increases your risk of other things such as trafficking. National data show that about 1 in 5, they use the phrase runaway and homeless youth, which I know is a little bit of an outdated term, but that's what this site used. 1 in 5 youth will be a victim of either labor or sex trafficking. And of young people who were trafficked or forced to engage in commercial sex work, 68% were homeless at the time that they were recruited into their trafficking situation. which is of course a really alarmingly high statistic. So that's a bunch of information and data that I know I just threw at you guys. Sorry for some of the more texty slides. Going to quickly talk about summary of our draft recommendations. I think if you add it all up, there's something like 37 or 40 total recommendations, some of which are very, very micro level. Some of them are much bigger long-term, but we tried to be as comprehensive as we could, and really give the community kind of a menu of what we thought might be needed, and then also get feedback on what's realistic, what's doable, you know, further looking into what is their funding for. So what's, you know, what's realistic for this community. So there's a whole bevy of recommendations. Again, some of them are things that can be done this year. Some of them are more like a 3 to 5 year plan to get them off the ground. But they sort of fall into these 6 main categories: community capacity building, homelessness prevention and diversion, outreach, interim and emergency services, workforce and income supports, and housing. So again, these next couple of slides do have quite a bit of text, and I'm sorry about that. Trying to find a way to make these slides a little more dynamic, and I couldn't really figure on something, but I wanted to share some high level takeaways that are in the report right now. In terms of capacity building, we recommend that Douglas County incorporate a local group, a collaborative group of multiple entities that can allow for centralized processes, competitive funding applications, and regional coordination, which should include MOUs to solidify cooperation and partnership between service providers. I know that many of you already have that in place, but trying to identify any gaps where that is and formally close those through the use of MOUs. Increasing the reach and the scope of some relevant trainings. These include things like trafficking prevention training, also things like trauma-informed care that I know Leanne and her team are trying really hard to expand, as well as things like homelessness prevention and problem solving, homelessness diversion. There are lots of trainings available in things like homelessness problem solving that can help, again, on that more upstream side of things, and hopefully preventing people from kind of coming through the front door of the homeless services system in the first place. There are many competitive funding opportunities from the state and from the federal government that we think Douglas County and some entities in the county would be really competitive for. You know, part of the capacity building honestly has to do with things like making sure there's the administrative capacity in place to do something like go after, you know, numerous federal grant applications and do the reporting requirements and things like that. So we do call out some specific funding opportunities in the report. And this last bullet point here, something we heard consistently is that there was a lot of fear about seeking services or about elevating concerns, and that it would sort of trigger more system involvement. So for example, like, you know, I don't want to tell a teacher about something going on in my home because I don't want to like get child and family services involved. So sorry, you can probably hear my neighbor's dog. Thinking about like a volunteer network of individuals, in particular, thinking about enlisting the faith-based community in this recommendation so that there was a safe place, especially for young people, that they could go kind of without fear of retribution or these maybe more authoritative kind of traditional sectors, which again can in and of itself be a barrier if it's a little bit intimidating for people to seek services. In prevention and diversion, again, you saw that that's a lot of what UCAN is doing with federal dollars. But when you also look at the poverty data, there's probably way more of a need for it. So thinking about enhancing those investments, opportunities to identify high-risk populations really early, again, kind of before they get to the point of losing their housing. So for example, maybe piloting a project for female-headed households with children under 5. This also talks about the housing problem solving approach. Those are all capital letters because it is an official HUD program. And yeah, again, it's about prioritizing solutions that produce the least amount of trauma. I know everyone in this group is familiar with trauma-informed interventions. So if it is possible to prevent someone from entering the system in the first place, recognizing that in and of itself is a trauma-informed approach. Ensuring that anyone working with youth or with families are able to really quickly connect them to mainstream benefits that they might be eligible for, SNAP, Medicaid, so on and so forth, just making sure that someone who is eligible for mainstream benefits is enrolled in them and getting them. Investing in diversion, and expanding host homes, which I think is something that's happening in Douglas County. I think there's also been a really wide state interest in expanding the use of host homes. I think if you go to the ODHS website on youth experiencing homelessness, they have some resources there. So the link that I shared to the CSH statewide roadmap, that website I think also has some information about host homes and kind of the statewide interest in that. In terms of outreach, obviously this is a really difficult population to get in touch with. People might be difficult to reach. Maybe they're staying on someone's couch and, you'd never know that they were homeless if they didn't self-identify. People might be really reluctant to come through the front door and start to get services. So thinking about ways to improve outreach so that people are engaged at whatever level they're comfortable being engaged with in services, and providers can build that rapport to get people what they need. So placing some collateral material like resource guides, especially web-based guides. Obviously, most people, even people experiencing homelessness, especially young people, still have phones. So, this idea is kind of about having like a QR code for an online resource guide that you can just snap it, you can tap it on your phone and get access to whatever it is that you're looking for. So making sure that that's really, really widely available. And it doesn't have to be like a ton of paper or a ton of flyers taking up a ton of space. There are other ways to get that information out. So again, expanding online platforms to kind of help connect people to what's available, how they access it, have a little bit of instructions, et cetera. Because it's such a large geographic area, the need for mobile outreach is really evident. So things like buying a vehicle or staffing it up is really difficult, but I think there's also some providers in the community who are thinking about doing mobile outreach, especially related to healthcare. So are there opportunities to kind of connect homeless services outreach with other ongoing mobile outreach? And if there's not, how can we launch some mobile outreach opportunities? And as part of that, this last bullet point, people, especially kids, might not come up and say that they're homeless and want to like enter the system, but having things like just like having pizzas, having Wi-Fi, if you're able to charge your phone, if you're able to get some socks or whatever, even if someone's living outside, living unsheltered, it's like they might still start to get in touch with the services system that way through kind of these like light touch opportunities. And again, you sort of build up that relationship, and maybe down the line they want to engage more seriously in more intensive services. Also, the need for collaboration with healthcare, primary care, mental health care, behavioral health. If people are getting healthcare services and are at risk of homelessness, those services should be really integrated. And this is something we talk about a lot in housing and homelessness policy is, for a lot of people with very high needs in their healthcare, if someone's experiencing homelessness, if a doctor could, they'd write them a prescription for housing. And so there's been a lot of effort nationally to think about bridging the gaps between people with really acute health needs and making sure that they're connected to housing services. In terms of emergency or interim solutions, just improving connectivity to existing resources. I know that there are need for more services in Douglas County, but filling in any gaps and making sure that there are no empty beds for what's currently available. Also, the opportunity to open up some satellite offices, or even if it's not an office, maybe it's office hours that case managers hold at like a library or a food bank or the school or whatever the case may be, 1 or 2 days a week, so that outside of Roseburg, it's still known that you can go to a certain place at a certain time of the week and get access to services or enroll in something. There are lots of places when I was on the coast last week that I know would be really great locations for that, for people who can't get into Roseburg. It's good to have the option. Something else that is very popular recently is the opportunity to do direct cash transfers. So for individuals who, are able to live with a little bit more autonomy, but are experiencing a lot of poverty, just an opportunity to get even small amounts of cash or to have a flexible pool of funds that are available to kind of get cash in people's hands, even if it's a small amount, but it sort of helps fill in a gap, whether that's you're a little short on rent, or you're a little short for your electric bill, or you're a little short for, fill in the blank. Transportation services, obviously that's a really critical need. Some people brought up some different ideas. Again, mobile outreach and transportation options kind of come up. The need for increasing the number of people with CDL licenses can also be a way to help kind of flush out the existing bus transport that there might be. Also options like dial-a-ride, even if there's like 1 or 2 days a week for that dial-a-ride is available, maybe that's an opportunity. And then additional shelter options. Right now, the recommendation is about exploring and securing financing for such a thing. It's not cheap to start or operate a shelter. So the first step into that is kind of identifying how it would be funded and making sure that it's sustainable. I swear I'm almost done. I know I've been talking for a while. When it comes to workforce and income supports, again, that's helping people who are at risk stay in their housing, or if they're able to exit the homeless services system and get into housing, making sure that that's safe and stable and affordable to them. So again, connecting people to mainstream benefits where it's possible, making sure that those enrollment specialists are integrated in anything that youth might already be attending or going to, like school. This one we heard about a lot, peer support specialists, especially peers who are young people or even people in their 20s who did experience homelessness as a young person. It can help with that kind of intimidation barrier to accessing services. You sort of see a friendly face, someone who's been where you've been. Peer support specialists are also a great opportunity because depending on the kind of training or certification that they have, it's also a Medicaid reimbursable expense. So that's also a recommendation that sort of comes with some built-in funding. Internship and job training opportunities. I know that there are a lot of those, but kind of thinking about opportunities to do, for example, supportive employment, if there's funding available for that, or looking into funding for something like that. Leverage regional services. That kind of goes back to the capacity building, just making sure that if there are any gaps, that an opportunity isn't missed to connect somebody to an available resource that might be the real difference maker in getting them housed. When it comes to actual permanent housing, there's a couple of recommendations. Again, some of them are for the near term, some of them are longer term. So something like a landlord mitigation fund that can help incentivize landlords participating in some available housing programs. There's lots of examples of this from around the country. Let's see here. And, similarly having a landlord database so that you sort of know who are more friendly landlords, who's willing to work with you, et cetera. And even within that, some young people can find their own apartment. They have a job, they can start working, and what they really need is like a roommate or just like some housing search assistance. And I know that sounds like a very light touch thing, but like I said, we're really trying to offer a full suite of recommendations. So, just kind of matching people up with a roommate, doing some housing navigation, making sure that individuals who are eligible for any move-in assistance are getting it. And by that, I don't mean like a rental subsidy voucher, but things like security deposit assistance, move-in fees, furniture. Someone who's enrolled in Medicaid, like UHA or Trillium, can pay for some of those move-in fees, and it kind of reduces the overall barrier to getting into permanent housing. And of course, building more housing is a recommendation, but that's a much longer term thing. So looking at creating more housing through the use of things like master leasing of units or a set aside of affordable units that can be done specifically for certain subpopulations, whether that's transition aged youth or youth aging out of foster care. Again, that might just be a few units here and there, but it is helping connect people to permanent housing. So that's a lot of information. I will stop. I know we're almost at 12:30. So I know some chat messages have been coming in. I'm going to stop sharing, and we will try to hear from as many people as we can.